Welcome, and my name is Marilyn Roderick, Dr. Marilyn Roderick, and I'm using my skills as an epidemiologist and as an infection control preventionist to try to help people who are afraid of this virus. And the way to help afraid people is by educating them about the virus. So I'm trying to teach people how to think like an epidemiologist. And the more you know about this virus and its activities, the better able you'll be to be in control of the virus instead of the virus being in control of you. And so that is my main goal. And this is session number 4, so we've been doing this for 4 weeks now. And I see Carol's name, but I don't see her picture. Anyway, Erica, no picture name. Okay, I have to just get serious. So this is the 4th week, and every week there are a lot of changes. So each week we're doing an update on what's going on with the pandemic, what's going on with the workers, the frontline workers, what's going on with treatment and vaccines. And then at the very end, we have a self-help exercise, which is my own version of a meditation. And I'll tell you about that once we get to it. So the qualifications to be in this Army, for those of you that are new, are to be a seeker of the truth, to be non-judgmental. That means we stand next to one another. We're all equal. We don't make fun of each other. Everybody has their own blend of what they need to do to do their own prevention program. So we accept everybody. And the last thing is we're kind and compassionate. So all of you meet all 3 of those criteria. And so welcome to the Army. I have to say the Army is getting bigger each week. And it's thousands of people, but I don't know how many, because it's Facebook and Zoom and everyone else. So I know that it's almost every single state in the U.S. and it's many countries. And so all of us are standing together, and we are fighting this virus, and we are helping each other and helping those who are on the front lines. That's the purpose. So, and I have a saying called trade fear for facts. I'm going to say a couple things about people that are in this Army this week so that you all will have an idea of who is standing here with you. And Jim, you're going to have to be the economist for next time. I'm going to get you to talk about what's going on in the world, in the economy.
No problem.
Oh, great. So I'm going to talk about 2 women from Africa, the continent of Africa. And I've talked to both of them. One is on LinkedIn and one is on Facebook. And we have talked back and forth as if we're right next to each other. And it's just the most astonishing thing. So the first one is from Zambia. Her name is Dorianne, and her last name is Ngosa. Nosa. And she says that in her town, which is several thousand, they have 16 cases, and she used the word isolation. So they are isolating at home. She says no hospital. And she said that there are 3 people who have died, 24 have been discharged. And she says there aren't enough doctors and nurses, so they have hired others to help take care of these people. And she says that they don't have enough masks and they don't have enough gowns. We talked about the cost of a mask, which is it's something like $2, but in terms of what that means in Africa, it's many dollars. So it was very Interesting, she has 4 children. She's 45, she has 4 children, and she has 2 more elderly people at home that are her, quote, dependents to take care of. Before this pandemic happened, she used to make scones, S-C-O-N-E-S. Now she does not have a job, no job, and she has no food, and she has to ask for food. And Zambia has just recently added 2 more weeks to, quote, observe the situation. The next woman is from Uganda. Her name is Wanumi Lasuli. She runs an orphanage called the Home of Dreams. As soon as I read that, I was just entranced. Can you imagine the Home of Dreams orphanage? And she takes care of 20 orphans whom she's the mother to. So I'm going to show their picture, but I don't know how well you can see it. But my computer last week, you might remember, was out of ink the night before that happened. It'd been saying out of ink for a year, and suddenly the night before, it couldn't print anything. So I'm going to hold this up and see. Let's see if I go this way. This is I have to go the other way because it's mirrored image. Jen, can you help hold this up? Okay, this is a few of her children. The big fellow, bigger, in the middle, and 5 little children around him, one with a little hand on his shoulder. They're in Africa. They have clean clothes on, but she's their mother. And I just don't even know what's going on as far as being able to feed them, but you can see every single one of them is smiling. Okay. The next person is a woman doctor from Costa Rica. Her name is Margaret Hamburg, A-B-E-L-L-A-N. She says there are 652 positive cases. This is in Costa Rica, 4 deaths, 74 recovered, and 16 are in the hospital now. She says this is their 6th week since the first positive case. She says that we are doing, and she writes, B-A-D, bad. And the next person is Dr. Shirley Yu, Y-U. She is a very prominent person. She is called Your Global Power on China. She is a political economist. She is a C-level and director. C-level means the C-suite, which means the president of, head of, CEO of a company, international speaker, and she's from Harvard, graduated from Harvard. So she is planning to post this video to everyone she knows right now so that all these folks that are in her network are able to see this video now. And the last one I have to mention is my niece's daughter, Serenity, who's 6 years old. And last week she planted a victory garden. I'm going to show you a picture because I couldn't last week. This is a picture of her victory garden. She is in North Carolina, and you see these bags of soil. This garden is planted with only seeds. The seeds are growing in a forest in the house first, but the garden is ready to go. And my niece, who has an underlying disability, we've learned to call it comorbidity, C-O-M-O-R-B-I-D-I-T-Y, comorbidity. But she managed to drag all these you can see in the background and in the foreground, all this soil back to plant this victory garden. And it has broccoli, carrots, lettuce. It has about 10 different vegetables in it. And we'll see how it's growing over the next weeks. And the last thing is I must give a shout out to Health Coach International, HCI. Now, I've never heard of giving a shout out without raising your voice. So this is the terminology we use when we are acknowledging somebody. So I'm giving HCI a shout out. There are health coaches from all over the world. They are from all over the world, from every country, it's just shocking how many people have joined my network from everywhere. And they are every type of coach you can imagine, from grief to weight loss to eating more plants. Couple people eating more plants. And that's what we should be doing. That is for sure what we should be doing. So all of these coaches are joining me, and I feel very supported by them, and I really appreciate each and every one. So why are we fighting this virus? I'm going to read to you a message that Alexis Sprogis, S-P-R-O-G-I-S. I'm not sure I'm pronouncing that correctly. She's from South Carolina. She posted this a few days ago, and this will help you see why we're fighting this virus. My dad passed away a few hours ago due to COVID complications. He had been in the hospital since Monday and on a ventilator since Tuesday. This was on Thursday. Due to visitor restrictions and hospital policies, I could not be in the room with him when he left this earth. But I did get to spend a wonderful 45 minutes with him prior to his extubation and death. Remember, when the tube goes into the throat and down to the lungs, and when it comes back out again, it spews a lot of the virus, which we'll talk more about later. But this was before the tube was taken out of his lungs. During that time, I talked to him. I held his hand, obviously with gloves, and I FaceTimed so that my sister could say goodbye. She could not be here because the restrictions with air travel due to COVID. They had music playing in his room, which is a lot more than many other people. They had music playing in his room, and the last song we listened to together before I had to leave the room was Willie Nelson's "You Were Always on My Mind." I stood outside of his room alone with my husband waiting for me in the parking lot because only one person was allowed to be there. A glass window separating me from the man who helped give me life, and I watched him die. I could not comfort him, touch him, or be there beside him during his final moments. It is not an ideal way to say goodbye to someone. Now, I'm thankful for the 35 years I had with him. He was a hard worker, kind, and helped so many people in his life as an alcohol and drug treatment counselor. The emptiness I feel in my heart at this moment is almost unbearable. If you are not practicing social distancing and staying at home, I beg of you to please reconsider. This virus is real and is a serious concern to everyone. In a matter of days, I watched helplessly as my dad's health deteriorated and was unable to properly say goodbye to him because of COVID. Please stay home and stay safe. That's from Alexis Sprogis about her dad. I want to say something about the medical workers on the front line, and you see all of their pictures all the time on television. This week I put something on my Facebook about a lot of them dancing in the hall right outside of their workstation, many of them, and they were staying alive is what they were dancing to. I cannot interview any of them right now because they're too busy, but I can say something about my own experience with my now friend, but at the time, the resident above me when I was an intern at Kaiser Hospital in Santa Clara, California. She said to me after the first time I did this video, she said, "Do you remember the night we had 25 admissions?" And 25 admissions is just astronomical. It means between the time the day shift was leaving, well, we didn't really have shift because you stayed till your work was done, but during the night, the emergency room admitted 25 people to the medicine service. That means to Bonnie Rastian and me, the intern. And usually one admission of one person takes at least an hour to be thorough and careful. Everybody who knows me knows my middle name is Thorough. Knows that I only have one gear, which is slow, and then slower. So Bonnie and I took care of these 25 patients all through the night, knowing in our heart of hearts that we could go back the next morning, even though we had not slept for 36 hours. We could go back to them the next morning and fine-tune what was happening with them, review what we did, make sure everything was being done correctly, make sure everyone understood the orders, and so we could go back the next morning. These doctors in the ICU are seeing 70 patients a day. 70 patients a day. They do not have the luxury to go back and fine-tune it the next day. They're seeing this many every day. Not to mention how many people are dying all around them. Dying without their family visiting them, like you just heard. Dying. I read something this week about people on ventilators and the death rate of people on ventilators, not in the United States. I haven't seen any information about us, but 60% of people in a European country were dying if they were on ventilators at all. And in Wuhan, all but 14% of people died. Only 14% if you were on a ventilator survived. The other thing I learned about ventilators this week is that after studying it now for many years, they realize that there are certain things that can be done to people on ventilators to help them stay sane and stay moving. You can imagine if you wake up and because you're not awake when they do this, they sedate you. You have a tube put down your throat, and you've all seen people with these tubes coming out of their mouths attach a big machine that's pumping breaths in and out of them. And everybody who comes anywhere near you, it's not your family, everyone is wearing a mask, or at least they should be, if they have them, and gowns. They don't have time to hold your hand. They do not have time to stroke your arm. They don't have time to try to reassure you. I can't even imagine how that must feel to them, to the patients, let alone to the families. The after effects of people that do make it off of ventilators are depression, anxiety, immobility. They're not able to walk. They have to learn all over again to do that. But I neglected to say that the physical therapists that normally go in and help these patients do not have enough personal protective gear, masks, gowns, they don't have enough to be able to go in and help these people on the ventilators. That's what's happening in our country. The average time on a ventilator in, quote, normal conditions of very ill people on the ventilator is 2 or 3 days, maybe 5 days. You get them off as soon as you possibly can, and you wean them off little by letting them breathe a little bit more and more and more as they can do it. The average time for people on a ventilator with COVID disease is 2 weeks, 14 days. So you can just imagine what more it does. I'm starting with epidemiology. This is a coronavirus. You've seen pictures of it. It's got like a crown around it, and it's got a fatty covering of it. And it's a relative of the SARS virus and the MERS virus. and they are all severe acute respiratory syndrome viruses. Anything that's worth anything at all is a syndrome in medicine. So these viruses, this particular virus, we know very little about. The people in China sequenced this virus. That means they figured out its exact DNA. It's an RNA virus. Exact RNA and what was replicating in the virus, to give it to the United States and all over the world. So when we got our first cases, the Chinese people had already sequenced this virus, which led to a huge advantage for everyone else. The virus is what's called a zoonose, Z-O-O-N-O-S-E. That's a virus that can go between animals and people. In this case, the animal is a bat, as was several of these other terrible viruses in recent years. We think it went from the bat to a monkey, but there are a lot of other choices, but most likely some type of monkey, and then jumped from the monkey into man. It's a zoonose. The other problem that has been in the past and is probably true this time is that they have wet markets in the southeast, not just in China, but in Vietnam and Cambodia, all over Southeast Asia. And it's a way many people actually earn their living in these wet markets, and they slaughter animals. And there is a big effort afoot to have them not slaughter the animals in the actual marketplace, but bring them in after they've been slaughtered. And also not to slaughter live animals. And there's a big list of animals that are not supposed to be slaughtered in these wet markets. Apparently in Vietnam and Cambodia, they've managed to get control of what's going on in the wet market. The virus is spread. There's now a somewhat big controversy about whether it spread from the monkey to man, or whether it spread from a lab leak. So they were studying this virus in a lab, and there is a question mark of whether the lab leaked the virus, either on purpose or by mistake, and that's how it all got started. I think it's probably the animals. Dr. Fauci, the doctor who's been the voice of sanity and also infectious diseases in our country, Dr. Anthony Fauci, said when people were asking about what about China, couldn't they contain it? He said that once community spread, which is another epidemiologic term, community spread means the virus is not just coming in from someone who's been in a community where there are COVID positive people. It's now spreading between one another in a community where there had not been any travel outside the community. So that is community spread. Once community spread starts happening, it's impossible to contain the virus. Containment is what we're all looking for to be able to stop the virus. It's called containment. So let's talk about how many deaths there are. Last week I had this chart, but I had to open it because my printer wasn't working. So this week I have the death toll as of April 15th, and we already know from watching the news last night that it's changed. So as of April 15th, the global case count was 2,018,351 infections. So over 2 million people all across the world are infected with this virus. There are 128,062 deaths. That is 6.3% of the cases have died. 6.3% have died. And 24.4% of people have recovered. So it's 492,000 people have recovered from the virus. And so when people are talking to you about how much worse it is and how much worse it's getting and everything, you know, if you were here last week, that what you need is not the actual number of deaths. What you need is how many deaths per million people have occurred. You cannot compare the U.S. and Spain when the population of the United States is many times more than Spain. So the best way of looking at it is how many deaths per million we're having. And so this, I'll just talk about the U.S. We have 614, this was several days ago, it's already a lot more. 614,000 cases, 26,000 deaths. We heard last night on the news, 35,000. Seems like every day there are 5,000 more deaths in our country. The number of infected people per million is about 1,900. The number of deaths per million is 79 deaths per million people. Let's compare that to Spain. Spain has 3,800 infected people per million. It has 397, so 400 deaths per million. So we have 80, they have 400. Italy has 2,700 deaths per million people. They have 348 deaths, 2,700 infected people per million, and they have 350 deaths per million. So that gives you an idea of the top four, and France is the other one. They have 2,200 infected people per million, and they have 241 deaths. So just to review that, the U.S. in terms of how many deaths per million people has 75, Spain 400, Italy 350, and France 241. And I'll read the next few countries. I know this is boring to some people, but for some people it's quite interesting. The United Kingdom has 178 deaths per million people. Belgium has 383 deaths per million people. We've hardly heard anything about Belgium. We have to read carefully to see what's happening in Belgium. The Netherlands has 183 deaths per million. Switzerland has 141 deaths. So we have 79 deaths per million people. Belgium has 383, Netherlands has 183, Switzerland 141. And the last two are Sweden. Sweden has 119 deaths per million, and Ireland has 82 deaths per million. So all those countries have more deaths than the United States does when you look at how many deaths per million people. So what is the source? This virus needs to live in people to reproduce. The reservoir, that's another term for where does this virus reside. The reservoir is human lungs. Human lungs. And respiratory secretions from the nose and from saliva. The nose has more than saliva. I've said before that the saliva of people with no symptoms has the same viral load. That's what we call it, the load, the viral load. How many are there? As the saliva of people that are sick. The same number. So that's one of the reasons the spread is so tremendous. Because all of these folks who have no idea they're infectious are able to go around and infect other people. Now, it's important at this point to say that it is not, the main reservoir for this virus is not fomites, F-O-M-I-T-E-S. Those of you who have been here before, have heard me say how long it lives on various types of surfaces. The maximum time is solid counters, solids, granite, marble, stainless steel even, the counters, solid. That is a maximum of 3 days. So the longest this virus can live outside of human lungs is 3 days. So I started to tell you a story last week about how when we were first doing infection control in the United States, and nurse epidemiologists, nurse and infection control nurses, of which I was one, and laboratory people were trying to figure out how to prevent spread among people. So the laboratory people were swabbing everything. They were swabbing countertops and beds and floors and ventilator, everything, and finding out where the virus lived. The nurses who were used to taking care of patients were concentrating more on what to do to prevent the spread among patients. And so the end of the story is that is the major thing that we've had to do to prevent spread of any infection to any other human being, is focus on the reservoir of the infection, which is human lungs. So what that means is when you go to the grocery store, if say you had 2 masks only, no, you had 1. Say you had 1 mask, and you could either give it, and you had someone with COVID coming right next to you soon, within 6 feet, within even 3 feet, okay? So you have 1 mask. What are you going to do with the mask? The answer is you're going to put it on the patient with the COVID or the asymptomatic person with the COVID. They are the ones who can spread it to you by coughing or sneezing. It's called droplet spread. That means when they cough, now we know they can, it even happens when you're breathing. It used to be just sneezing or coughing. Now it's even when you're breathing, and it can go, all these things about, technically speaking, it can go many feet, like 13 feet I read this week. But the main thing is 3 feet. And that's why you use an abundance of caution. That's another term we use. An abundance of caution, and you stay 6 feet away from anyone that might have COVID. So why we're all putting on masks, only not just to step out our door and go for a walk. No, when we are wearing the mask when we go to areas like the grocery store or the pharmacy or the doctor, which are the only places we should be going. When you can't maintain an adequate distance, social distancing, that's when you put on the mask. And you're putting on the mask because you don't know whether you have the virus or not. You don't know whether you're contagious or not. Now, realistically speaking, this is now not just talking in medicine. Realistically speaking, a lot of people are putting on masks to protect themselves from getting COVID. If everybody wore the mask, and it doesn't have to be a hospital mask. The hospital masks need to be donated to people that are on the front lines that do not have masks. Do not have masks. You put on a mask, and there are all kinds of instructions for making them. And on my website on Facebook, I have the Surgeon General teaching you how to make a mask out of a piece of cloth and rubber bands. So you put on that kind of mask because you are not in a situation where COVID is all around you. Those people need those masks. As I said before, my cousin's husband, my Stanford Medical School alumni, he is a neonatologist taking care of newborns who have severe diseases, who are born prematurely, have severe diseases, and he is actually intubating them, of course, to be able to help them breathe. And he has 1 N95 mask. That N95 takes care of 95% of the pathogens that come up against it. Jillian, how can I enter? You have to help me get people in from the waiting room. See, you have to let them in. I don't know how to do that. At any rate, he has 1 mask per week. So that has to be improved upon. We're trying to admit people from the waiting room, which is pretty amazing. Well, I guess we just have to study more about Zoom. I've already studied too many tutorials on Zoom. Okay, so it's not spread by fomites very much. It's mostly spread, it's always spread by human lungs and saliva and nasal fluid, but mainly lungs, and it's from people that are asymptomatic, meaning no symptoms and don't know they have the virus. So that's why they put the masks on, and they put cloth masks on when they're going to be within 6 feet of you, closer than 6 feet when you're at the places that you're supposed to go. The grocery store, the pharmacy, and medical care, and gas. We have to think of all those people that are working and still putting their lives on the line when we go to mail things, even when we go to the grocery store. All those people are putting their lives on the line for us. Remember all these medical workers that you saw every week, but especially weeks ago, they had signs up saying, "We go to work so you can stay home." So that's our job, is to stay home. And we know that we have the ability to send people compassion, to send people loving kindness, to send people, these people in Africa who have no food, to send them our loving kindness, just so that you feel like you're doing something to help them, even though you're staying at home and practicing the things that you know that you need to do to help overall. Okay, so the next is treatment update, and we're doing all these things every week now. Treatment update. What's happening with hydroxychloroquine? You remember 2 weeks ago, I talked about Dr. Oz giving a message from a French doctor about 80 patients given hydroxychloroquine and Zithromax, a Z-Pack, at the same time, and all but one got better. And there was no control group. There were 80 patients. Just to tell you what's going on with the vaccines, I will tell you in a minute, but the number that they're looking for as a minimum is 1,500 in each of the treatment group and the control group. The treatment group and the control group are given the medication that is the real medication or that looks like the medication. So I used to be a principal investigator. We used to stand up at the front, and we used to dispense this medication one by one. We timed everything, and it looked exactly the same, and no one knew who got it and who didn't get it. So that's what a control group is about. It's the only way that then you can analyze at the end whether the drug is, number one, safe. Those are the two things. First, it has to be proven to be safe. And the next thing it has to be proven is to be effective. Does it work? Efficacious. Does it work or not? So when the hydroxychloroquine got approved by the FDA they have these things called emergency use. It's already approved for treatment of malaria and prevention of malaria. So as I said last week, it treats parasites. It's hard to kill parasites, so a drug that does kill parasites has a lot of side effects to it. So the people who are meant to get this drug, who have rheumatoid arthritis and lupus erythematosus, they can't get the drug because it's being stockpiled and hoarded by how many people all over our country. It's being imported from who knows what sources, who knows how it's made. President Trump ordered 20 million doses to be stockpiled in our stockpile. I'll just say nothing more. So this week, there are many federal FDA prior commissioners who are making an outcry. That is the word that's being used. They are making an outcry. The one that I knew the best was Margaret Hamburg. One thing she said along the way was, put science ahead of hope. Put science ahead of hope. All these former FDA commissioners are saying, now we'll never have, because this was done with flimsy evidence, anecdotal evidence, meaning that study of 80 patients. That's anecdotal. Because this was done with so little evidence that it's safe, you should read the safety. You should read drugs.com. I told everybody, look up drugs.com and look up, the easiest word is Plaquenil. 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 Look up Plaquenil, and you'll see that it's used to treat parasites. It's an immunosuppressant. And the things that it causes are cardiac toxicity. It can cause people to die from cardiac toxicity. And the thing I always remember it for is bone marrow suppression, aplastic anemia, and it doesn't come back. It's just, you know, it's your whole body's immune system is knocked out. And so are the red blood cells that make transport your oxygen. There's another drug called Remdesivir, Remdesivir. It's a new drug, and it's an antiviral drug. And what's happening now is the study of this antiviral drug is delayed. There are lots of studies that had been put into effect before this emergency use, studying hydroxychloroquine. But the trouble is, who would want to be in a control group if they think because the FDA approved this drug for emergency use that that's what they need to be taking? So no one wants to be in the control group, do they? It's just unconscionable. One more thing I want to say about the virus, which I thought was an interesting thing. I told you that you can't see it through a regular microscope. You have to use a fancy, what's called an electron microscope. So to get an idea, 100 million of this type of virus can fit on a pinhead. 100 million can fit on a pinhead. What about the vaccine? Update on vaccines. The first thing to say is in South Korea now this week, most of you have heard that people who had tested positive, then tested negative, admit, Bonnie, hit, admit right there. In South Korea, people that were tested positive, negative, now they're testing positive again. What does this mean? Has the virus mutated so there's a second wave of it? My niece, Laura, asked about the epidemic curve, and we really don't know enough about this virus to even say what the epidemic curve is, but could there be another outbreak coming? We just don't know enough to, well, most of you also know there's been a 3-part plan to start getting our country, the U.S., back to working again. And I'll just let you read all the things about that. The other thing this week that's been very big in the news is that our president is trying to withdraw funding for the World Health Organization. We are the major funding person. We are the spirit behind the World Health Organization. And the United Nations General says during a pandemic is not the time to be withdrawing funding and ordering an investigation of how it was mishandled in the first place. So those are sort of off the record, but I just have to say something about them. Okay, so as I said, there are 25 vaccines being tested right now. They're tested using various what are called platforms, different ways of preventing this virus from entering human cells. One of the things that they have considered trying is for people that have recovered using their plasma, which is the part of the blood that doesn't have red blood cells. It's the white part of the blood, white cells and other things. That's where antibodies are. That antibodies are the mechanism that humans use to fight off various types of infections. So using the plasma of people that have recovered might help prevent others from getting it. This would not be like a vaccine, it would be a type of treatment right now. So the vaccines being tested are by various platforms, and the idea is to try and winnow down, that's what someone said, winnow down the 25 to 2 or 3 that are the most likely to be effective. The time frame is just like it's always been. It's going to take 1 year to 1.5 years before we get a vaccine, before we can start injecting people with something that will protect them. And at first we will not know, and we don't know either if people survive this. Now we see what's happening in South Korea. We don't know if they're protected for, it should be at least a year. But with this virus, now we're not really even sure. But the vaccine should protect them for at least a year. Look at influenza virus. We have to get an injection once a year in the fall in this country, in US, to protect us from or try to protect us from the influenza virus, because it changes shape. It mutates so many ways that we have to see what's going on in Australia on the southern hemisphere to see how to make our vaccine 6 months in advance. So it's going to be a while till we get the vaccine. So the bottom line is we have to keep doing what we're doing. We have to keep social distancing. We have to not touch our face and mouth. We have to put on a cloth mask only when we go into areas where we cannot stay 6 feet away from people. The virus is not going to jump off anything in their house and into their lungs. Remember, if it jumps off the whatever, which it's not going to do, it's just in a droplet. If it jumps off, which it can't do because it's in a droplet, then it needs to get into your mouth or nose, and it has to go down into your lungs in order for you to be infected. It has to jump off, can't do it because it's in a droplet, contained in a droplet, which sinks to the ground or to the next nearest surface, sinks to the ground when it comes out of a person's mouth who has COVID disease. Then, in order for you to get infected, not only does it have to jump off, it has to get into your mouth or nose and go down into your lungs. So hopefully that will help you. This is my message from me to you. I don't know how many people are watching this, probably a lot less who are willing to stay around and wait for us to correct the internet problems in this household. But I need you to tell me that you're here with me. I need you to tell me that you're here watching. So if you're on Facebook, I need you to do 3 things. One is message me on Facebook and say, checking in, your name, where you're from. Then I need you to like the page and follow the page. That way I'll know how many of you there are. Please do it. Please, that will help me keep going. I've been paying to boost this advertisement, to boost this message that we have on Facebook every week. This past week, Facebook didn't have enough workers, so they didn't even start boosting the message until Wednesday. So now it's going to be going till the next Wednesday when we already have another video in between. So I'm not going to be paying to boost it on Facebook anymore. So I need you all to boost it for me and everybody to tell one person. This is true on Zoom also. On Zoom, I need you to, for those of you who are on my personal email, just send me a little message. You don't have to write much. Just say, it's so-and-so, I'm here, and that's it. But also, for everyone, tell one person you know who is afraid right now. Presumably by week 4, many of you are not afraid of this virus. You know how to control the virus. It is not in control of you. And I'm saying the same things every week because every week I have questions that mean that I do need to repeat it. The virus has to jump off of something, off of the apple in the grocery store, into your mouth. It just, think of how it has, what has to happen for it to spread. So I need you to also message me on, I don't have that thing that I usually hold up, but it's impossible to hold it up now anyway. my Outlook. Message me. You could message me on LinkedIn, on that message thing, on LinkedIn. And you could message me on Outlook. And the Outlook message is, the Outlook email is Marilyn, Marilyn, Roderick, no space, just Roderick, no capitals, Roderick, MD, at Outlook, outlook.com. Just let me know you're here.
Facebook.
I said Facebook already. And let one person you know, at least one person, let one person you know share the information that I'm giving to you. My friend Patricia Litzler Rogers from medical school, she's the one who's an OBGYN and has delivered thousands and thousands of babies. She has a good friend from undergraduate school at Stanford who is now a professor at Brown University in Rhode Island. I used to live in Boston, so I'm very familiar with everybody from there. And she is showing her students at Brown University these videos. She teaches political science. She is showing her Brown University students these videos for their online learning. So if anybody is at Brown, could you please message me on the outlook.com. Marilyn Roderick, MD at outlook.com. Hi, Brown. So now we're up to the last part of the video for today, and I do appreciate everyone surviving and waiting during the major compromise. The last thing we do is called a self-help exercise. Thank you, Bonnie Rathjen, for renaming it. It's my version of my version of the exercise. And there are 3 parts to this exercise, and I'm going to tell you what they are ahead of time. The first thing is to relax your body. And to relax your body, and for that I'm going to do a guided imagery. So all you have to do is find a place where you can relax and where you'll not be interrupted. And the next thing, part of this, part 2, is to relax your mind. What we're going to do about that, some of you, many of you I suspect, already have done meditation in the past, but meditation is something that is an Eastern Indian tradition, and you use a word. I learned transcendental meditation when I was 25 years old. My friend Patricia has learned it also. And you're given a Sanskrit word, S-A-N-S-K-R-I-T, a Sanskrit word. So I have my Sanskrit word, and when I meditate, I use that word. We're going to use the word love, L-O-V-E. And when you meditate on love, you'll be closing your eyes, you've relaxed your body, and then you allow yourself to think about the word love over and over and over and over. Love. 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 Like that. If you have thoughts that come into your mind, you just let them come in. You don't try to block them, but then you let them go. So the thoughts come in and they go out of your mind while you are concentrating on, you're meditating on the word love. And the last thing we do is to ask for help. So for people, I'm telling people that we're asking for whatever is our higher power, whomever we pray to. For us Christians, it's God, it's Jesus, it's the Holy Spirit. For Jewish people, it's God, it's Allah, it's Muhammad, and I don't know all the other ones that it could be. But the thing that I think these entities that we ask for help to have in common are loving. That's why I wanted to have us meditate on the word love. So we ask for help. For those of you who don't have a higher power that they pray to,
maybe just ask the universe for help. I thought of that this week. Why not ask the universe for help? It's very non-specific, but I think we need to ask any entity that we know is larger than ourselves to help us fight this virus. We need help. I want to just make a mention that my daughter Jillian is going to help me put these videos ever since week 1 on YouTube this week. So I've had people ask me who couldn't get in last week because Zoom decided to insert a password. Then I put in the password 123456 last week and people still had problems. So I'm going to put all these recordings on YouTube. So you'll be able to just go directly to YouTube. If you don't know how to do it, ask somebody younger than you. They'll tell you how to go on YouTube. The other thing I want to say is at the beginning and at the end, I always say, and at the end of every message, I say aloha. That's because I spent most of a decade living on 2 different islands in Hawaii, on Kauai, and my friend, I'm blocking her name right this minute, but she says aloha from Kauai. Vicky. Anyway, I have my Hawaii license plate right here so you can see it. This is what a license plate from Hawaii looks like. Does it say it backwards? It might be. If it's backwards, it's called the Aloha State. The top says Hawaii, and it's got this rainbow. That's Hawaii. The reason I say aloha is that aloha means hello, and it means also goodbye. The same word is the same for hello and goodbye in the Hawaiian language.
I love you.
It also means, my daughter reminds me, it also means I love you. What other language says hello, goodbye, and I love you with one word, aloha? So when I say to you aloha, it means all those things, including I love you. So let's start our self-help exercise. So, quiet place, relaxed chair, couch, posture. You could be sitting on a floor with your knees bent. Close your eyes. Relax your body, starting with your toes. Relax your toes. Wiggle your toes. Do everything you can to help them go limp. Relax your feet. Relax your feet. Now relax your ankles. They do such a good job holding you up, but they need not to be active now. Let them relax. Now relax your lower leg. That would be your calf, the one that has all those muscles in it that cramp up when you don't want them to. Let them relax. Your shins, the front of your lower leg. Let that relax. Now relax your knees. Relax those knees, no matter how painful they might be right now. They are relaxing. Since you don't have any weight on them, most of you are not going to have pain in your knees. Next, relax your thighs. Thighs have those quadriceps muscles, those big muscles. Relax the front of your thighs. Now relax the back of your thighs. Now moving up to your torso, relax your abdomen. Just try to think about all those muscles in your stomach and abdomen just going limp. Now relax your diaphragm. The diaphragm is above your stomach. It helps you talk, breathe. Relax that. Now relax your lungs. Keep on breathing, but take slow, easy breaths. Breathing in to the count of 3. Breathing out to the count of 5. Now to your back. Relax your lower back. That L4-5 lumbar, sacroiliac. Relax those muscles. Now relax your shoulders. In the area between your shoulders, relax your shoulders. Move them up and down, back and forth to help them just go limp. Now your upper arms. Relax your deltoid muscles in your shoulder and relax your upper arms, front and back. Front, back, elbow, forearms, front, back. Now relax your wrist. So important, those wrists. They shoulder so much of us. Relax those wrists. Now your hands. Relax your hands. Just put them down at your side or rest them on your thighs. Just relax your hands. Now your fingers. Relax all 10 fingers. Now go back up to your neck. Maybe turn your head from side to side easily. Side to side. Relax those neck muscles. And now go up to your face. Relax your jaw. Just open your mouth and close your mouth slightly. Relax that jaw. Open and close until it's just limp. Now relax your eyes. Your eyes that are so helpful. They need to rest now. Your eyelids, rest. Your forehead. Rest your forehead. Rest your forehead. Now your scalp. Relax your scalp, which has so many tiny little muscles. That's why you have such terrible headaches, because they can make those muscles cramp up. Relax those muscles in your scalp. And your hair that's attached to your scalp. So now your whole body is relaxed. Now we're going to relax our minds. We will meditate on the word love, just the way I taught you at the beginning. Slowly say the word love. And we'll meditate for 5 minutes, which may seem like a lifetime to some of you. If you're not used to meditating at all, 5 minutes is like a lifetime. So I may have to stop in 4. So close your eyes, your body's relaxed. Meditate, thinking the word love slowly. Let thoughts come in and go out. Breathing in, breathing out. Meditate on the word love. So it's 4 minutes now. When you all are doing this at home, try to do it for 20 minutes. You have to work up to that, but 20 minutes morning and evening. This will help you relax. That will help you be strong. That will help you share compassion, share loving kindness with everyone around you, your loved ones, the medical workers, all around the world. And now part 3 is ask whomever you pray to for help, making you stronger, girding up your loins, as I said in the first week. Something from the Bible, but it's girding up your loins. And walking in the light doesn't need to be the Bible. We're all walking in the light of the entities that we pray to help us. We're walking in their light. We're not afraid. We'll help others be not afraid. So thank you for watching. I'll see you next week, and I'll say aloha.